The basis of radiation protection in nuclear medicine.
Radiation protection is applied radiation physics and radiobiology. Radiation protection includes the private and public promotion of those practices that limit exposure to ionizing radiation to the smallest amount. When the principles of radiation physics and radiobiology are intelligently applied in a clinical setting, the dose to the patient is limited to the lowest amount possible. ALARA is an acronym standing for as low as reasonably achievable. It is based on an assumption that radiation can cause harm and any exposure to radiation should be kept as low as possible within limits. Radiation protection could be practiced mechanically without an understanding of the risks and benefits of radiation. It can be practiced well only by an individual who understands the risks and benefits of radiation. Perceived risks ask individuals or groups of individuals to express their perception of risk. Risk comparisons make comparisons between two or more activities. Without ionizing radiation, the health of the population would decline because we would lack the ability to diagnose disease and to pinpoint trauma.
Nuclear Regulatory Commission (NRC) has set limits of radiation exposure for radiation workers. Monitoring personnel radiation exposure is one way to assess that radiation safety practices and the ALARA concept are being observed. The body badge, which records exposure to the whole body, should be worn between the shoulder and the waist in the area most likely to receive the greatest radiation exposure. Radiation exposure to the hands is best assessed with thermoluminescent dosimeter, designed to be worn as a ring. The ring should be worn on the dominant hand with the thermoluminescent crystal facing the palm, since the palm will be receiving the greatest radiation exposure when manipulating radioactive material. Consistent with ALARA, reasonable and cost-effective means of decreasing radiation exposure and protecting the technologies include the use of time, distance, and shielding. Shielding. One of the most effective means of decreasing radiation exposure is to absorb most of the radiation through the use of shielding around the radioactive source. Specially designed lead shields that fit around radionuclide generators are necessary because a generator's internal shielding is intended only to meet Department of Transportation regulations for shipment and radioactive materials. Additional shielding is required once the generator is set up for operation in the nuclear medicine department. An L-block shield should be used during the preparation of radiopharmaceutical kits and unit doses. In some instances, the use of shielding is not practical. Minimizing the time spent working with the radiation source and maximizing the distance from the radiation source are other practical methods of reducing radiation exposure.
Types of radioactive waste: low level waste, intermediate level waste, and high level waste. The radioactive waste at hospitals or nuclear medical centers mainly comprises of low level, solid, liquid, and gaseous waste.
Instruction to hospital personnel. Housekeeping and maintenance staff should be informed that certain areas they enter contain radiation and instructed about the meaning of signs posted in the area. They should be told that radioactive materials must not be discarded with other ordinary trash.